Hey, you're keeping company with Connor, and you're listening to another Townsquare Spotlight. The Paris Olympics amazed audiences across the globe this summer, and it was wonderful to see all the athletes compete, do their best. So many inspiring stories, but you know what? There are a lot of people in the background that you don't always get to see on television. You get to see all the athletes, but you don't necessarily see the teams in the background that are helping to support all of them. So that's why today is really exciting. With us, we have one of the official doctors of Team USA from the Paris Olympics. We have sports medicine physician, Dr. Jason Zaremski. Dr. Zaremski, how are you?
Good. Thanks for having me.
I'm really happy to have you on. This is so cool. You were there. You're part of Team USA, and I think very huge and crucial part of it is like you need somebody to take care of all the athletes. And I'm sure that you specialize in certain practices or certain teams and all that. But before we get into necessarily this summer and the Olympic Games, for anybody who is unaware of what a physician in sports medicine does, would you like to give us a little overview on your position and your responsibilities?
Sure. So, sports medicine physicians, usually, for the most part, they come in two main forms. One is an operative or a surgeon, so usually like an orthopedic surgeon who specializes in arthroscopic surgery, so like the shoulders and elbows and knees and things like that. And then you have your non-operative sports medicine physician, and those individuals may have little slightly differences in training, whether it be physical medicine, rehabilitation, whether it be primary care, family medicine, whether it be emergency medicine or pediatrics or internal medicine. But basically, you classify it as operative versus non-operative sports medicine. So my role as one of the non-operative sports medicine doctors at University of Florida is, when I see patients for any and all musculoskeletal related injuries. It may be a sports related injury where you just hurt your elbow playing baseball. Maybe you've got chronic knee pain, you're 65. Maybe you've got some shoulder pain because you've been a teacher for 30 years and you're writing on the chalkboard, although now it's all smart boards, and everywhere in between. And my role really is to see how we can make you better, kind of reduce your pain, get you as functional as you can be, whether it be on the field of play, whether it be for work, whether it is for losing weight, basically just kind of improve your function overall. But also when there's more of an acute injury, knowing when is the time to get an appropriate, maybe like the right imaging study, do an injection, or in some cases when we need to get you over to a surgeon for a surgical intervention.
That sounds really important, and it's when you're working with Olympians, you got to be taking extra special care when you're looking after everybody, as I'm sure. So how long have you been a part of Team USA then?
So my first time I rotated through Team USA was at the U.S. Olympic and Paralympic Committee's training center in Colorado Springs. That was in 2016. So I did a 2-week rotation there. I then was supposed to assist with a international event that got delayed and then canceled due to COVID.
Yeah.
And I did another rotation in Colorado Springs in 2022. And then in 2023, I was asked and I was put on as a kind of a backup member, if you will, for the Olympics. And then I got taken off the backup list about 7 months ago. So I found out last January that I was asked to be, one of the team physicians in the village for Team USA, which is, one of the greatest professional moments of my career.
Amazing. So let's talk about that. There you are in the village. You're working and assisting all these Olympians. You're getting to experience all these various games. I'm sure you're helping out a number of the athletes. What was that like being there and soaking that all in, first of all? Just as a fan, what was that like?
It was kind of surreal, to be very honest with you. On one hand, you don't want to look at it like a fan. You want to look at it as like, we have these athletes. You have to look at them as folks who just need help, whether it is a primary care issue, whether it was an infection, whether it was a blister, whether it was a joint issue, whatever it is. And our role, we're the team behind the team. Our role is to do whatever is needed for the athletes, their coaches, their support staff, for any and every sport. So whether it is everything from a medical aspects to get the appropriate treatment, whether it is to communicate in a timely manner, and it's very timely when you're during the games, whether it's something as simple as helping pick up towels, get ice, set up the clinic in the morning. Basically, what's really nice is it's an entire team. Everyone that is part of Team USA and the sports medicine clinic, everyone is working for one goal, and that is to help our athletes achieve their goals, which is ultimately do well and hopefully get a medal.
Amazing. Absolutely amazing. And one thing's for sure, Team USA did very good this year. So
they did very well, yes.
It's really great to see. So what were some of the specific sports or teams that you were able to assist in this year?
So the way it worked, kind of give you a little peek behind the curtain,
Please
is
do. Yes.
my role, it's a pretty large sports medicine clinic, and there's multiple clinics throughout the Olympics for Team USA. The Village, which is where I was, probably had the largest, and then there was a couple other locations, two other locations in Paris, and then a few throughout the country because there were other events. So, down in Tahiti, there was surfing, as an example. Soccer was traveling, basketball was traveling throughout the country, and a few other events as well. But essentially, the way it worked in the clinic is if an athlete, a coach, or a support staff member needed anything, they would come into clinic. So that meant myself and our colleagues, we assisted with every sport. It wasn't one sport. It was every sport we assisted with.
Amazing. Absolutely amazing. So, as you said, this was a highlight of your career, and this is just amazing and surreal to be there. But I'm sure that there were challenges as well that maybe you have never faced or never seen with that. So, when it comes to assisting the Olympics, of all things, what was that like? How was that different than when you were back in the U.S., in your field offices? You have plenty of time, but now here you are in the Olympics, it's happening, and this is right here, right now.
So in some respects, it was similar. If you think of it like, let's say during football season, well, there's games down here either Thursday or Friday night for the high schools, college, obviously, usually Saturdays. So if something's going on and a football player gets injured on, say, a Friday night, and you see them Monday in clinic, we might want to get things done very quickly to see if they can play by the next Friday night. So from that perspective, it's similar. But on the flip side, there are a lot of rules and regulation things that are very different at the Olympic and Paralympic level. There's a lot of restrictions in place. For example, no injections. There's a no needle policy that the International Olympic Committee instituted at the Olympic Games. So things such as injections really couldn't be performed. Different medications. Certain medications could be provided, but certain could not because they go against WADA, which is the World Anti-Doping Agency. And then obviously timing is a huge factor. You have someone that has trained for 3-4 years that are longer, but since the last games, since Tokyo, and you don't want to have an illness or maybe a milder injury derail them. So if someone comes in at 2 p.m. and they need to be ready at 2 p.m. the next day, you got to get moving. So whether it means, can we get an MRI done in an hour? Can we get medication in an hour? Can we do testing in half an hour? It's the time constraints more than anything. I think one thing that is really amazing, and I was impressed by all of my colleagues, is it doesn't really matter who's walking in the clinic. Yes, there's very visible people that's probably known throughout, for sports fans throughout the U.S. and throughout the world, but you have to treat them as just an individual whose knee hurts or an individual whose throat is sore. And that's how you have to look at it. We can't be fans. We have to be their doctors first and do what's best for them. And I think that's one thing that we try to teach our young trainees, residents, medical students, that if you're going to be a sports medicine doctor, you can be a fan, but you can't treat athletes any differently. You have to be their doctor first and then do what's best for them. And in this case, it just happens that there's a little bit more of a spotlight shown on because it's the Olympic Games as opposed to, say, a high school game, as an example.
Absolutely. I love the fact that you're able to separate that and you're able to take that integrity with you wherever you are, whoever you're working with. And I think that's really important. So now I really want to ask specifically, well, obviously you probably have to use generalities and you probably can't use many names or anything, but when it comes to your time there, do you have any specific stories that have stuck with you, whether that could be watching a game or working with somebody, anything that's inspired you and stuck with you and you think you'll, probably always remember after these games?
Well, I think one of the coolest things is just being in the village. You walk outside of the clinic and every, country that is there, they're all there.
Wow.
You walk outside and everyone's interacting, and you could turn to the left and you hear Spanish, turn to the right, you can hear an African dialect, then you can hear Norwegian, language. So it's just kind of amazing. And no matter what's going on throughout the world, everyone's kind of coming together for the same goal. Everyone is in it for the right reasons. So I think that alone, just being there was sort of surreal, but also just very humbling and very cool at the same time. In terms of events from a sports fan perspective, I was fortunate enough to go to the women's soccer gold medal match as a fan. And I love soccer. I actually helped cover at the U17 U.S. soccer level. So, it's pretty cool to see that. And so it's amazing to be at the Paris Saint-Germain or PSG Stadium, 50,000 fans cheering on these two female teams, the women's soccer, the U.S. and Brazil, 50,000 people going nuts for a couple hours. That was awesome. And quite honestly, one of my favorite moments was the U.S. women's rugby sevens winning the bronze medal when one of our athletes kind of broke through like a running back for a 95-yard touchdown, if you will, as time expired. That, as much, there's a lot of great events and everyone has their own memories, but as a fan, I think that rugby image in my head, basically winning a medal for the first time ever as time expired, kind of stuck in my mind as kind of like, where were you? But yeah, it's just, and just working with everybody in clinic. We, in our clinic, there's, our chief medical officer, director of sports medicine for USOPC, but then also you have massage therapists, you have athletic trainers, chiropractors, athletic trainers, physicians who are orthopedic surgeons, physicians who are family medicine doctors, physicians such as myself who's trained in physical medicine. We have all there for the same goal, and it's to support our athlete, provide comprehensive, excellent care. And, by how Team USA did, they ended up winning the gold medal by one, I think it was, over China. And obviously did very well. It was the greatest number of medals won outside the United States, because not counting 1984, since something like 1904. So It was a very successful games, just objectively. But as a sports fan, to me, it was the women's soccer match and then the women's rugby sevens win that medal as time expired.
Both very inspirational moments. I remember watching the women's soccer. I didn't see the rugby one at the time, but I did see the recap and the clips of it. Amazing. That's like a movie scene. Yeah. That's like
it's basically breaking through for 95-yard touchdown as time expires if you're watching American football, and that's what happened.
Amazing. Honestly, I feel like that's something like you would see out of a sports movie. Who knows? We might get a sports movie out of it one of these days.
You never know.
You never know. It's that inspiring and that impressive. So I love that. Thank you for sharing those moments with us. I think that's incredible. So now bringing it back more domestically, we were talking about before we got on the mic how a number of schools are coming back into session. And with a number of schools coming back into session, whether that's college, high school, middle school, whatever level that might be, school sports are returning. So for anybody who's listening to this and is involved in sports, what should they be worrying about and focusing on to be able to have the best season that they can offer for their team, for their body, for their overall health?
Well, I think there's about 3 or 4 main things that we worry about, I think, as sports medicine providers when the school year starts up again in the U.S. And at University of Florida, we have an initiative here called the Heat, Heart, and Head Conference. We do this every year. We had ours while I was in Paris this year, but this has been going on for now 13 or 14 years, where we are really emphasizing the importance of being aware of exertional heat illness or a heat event, number one, sudden cardiac death, and then obviously head injuries, concussion. Those are our big 3 that we really want to make sure that the kids, the student athletes, parents or caregivers are aware of. And if you're fortunate to be at a school that has athletic trainers, please make use of athletic trainers. They are pretty much with the kids more than the parents sometimes, especially during football and soccer season. I can tell you in Florida, soccer is actually a winter sport because it's too hot here. But I know in New York, I grew up in the Chicago area. It's a fall sport in
Yep.
most states throughout the country. So I think those things, recognizing when there is a heat illness event, recognizing if there, God forbid, if someone goes down with injury, having an AED or making use of your athletic trainer. And if you're fortunate enough to have an athletic trainer, trust him or her. And if you don't, please advocate for having an athletic trainer, particularly if there is a contact or collision sport. So things like football, rugby, ice hockey, soccer, basketball, for sure, because the risk of injury goes up. And obviously, heat illness this time of the year, whether in New York or Florida, heat illness is a real challenge. Unfortunately, I think according to what I've read, there have been 5 deaths in August so far, and this happens every year. There's usually a handful of things that occur. We don't know exactly what happened because that's every case is different. But it's really kind of a grassroots approach, starting at the high school and adolescent levels. And if I were to recommend anything to your audience in the Hudson Valley area in New York, is please, if you don't have an athletic trainer, advocate for your school board, your school district, or school principal to find the funds to get an athletic trainer, because he or she is your best advocate and best resources for keeping your kids safe.
I think that's really important. As somebody who played sports all throughout middle school and high school, pretty much every season, I did soccer in the fall, basketball in the winter, and lacrosse in the spring. I was always going, and injuries ran rampant, and it was really important to the fact that we did have somebody there to advocate there for us. And honestly, they were very stretched thin amongst everything. So, yeah, no, that's extremely important. And as also somebody who's been a camp counselor and has had kids, we've had to take them off because of heat exhaustion during the summers. Like, I know how scary and worrisome it can be.
Oh, yeah.
So you got to definitely look into those things. So thank you so much for going into all of this. And again, thank you so much for your time. In the last 2 minutes that we have, do you have any last little nugget that you have to offer the Hudson Valley audience, whether that be about sports, whether that be about the connection that the Olympics can offer, or just about anything? What would you like to leave them with?
No, I mean, I think it's awesome. We want to get our kids out there, get them off the couch, get them off their phones, get them off the video game controllers, or whatever they're calling it now. But it's also important that the kids prepare for their season. We see a lot of injuries to sports medicine providers if football or soccer starts August 1st and they show up to practice on August 1st. Well, they're going to get an injury from overuse, or they're have prepared. So you got to prepare what you're going to do. It's the same thing. If you're going to run the Boston Marathon, do you show up on April 15th? No, you probably trained, or you should have trained for at least 8, 12, 16 weeks beforehand. And sometimes that's a little tougher to explain to an adolescent or a high school kid when resources are limited, mom and dad are working maybe 1 or 2 jobs, and it's a little bit more on them. At the college and professional level, it's very different. There's a little bit more responsibility. There's some repercussions if you're on scholarship or you're a professional athlete. But if you're under 18, take control of your body. If you're going to be playing, we're already into August, so whatever's done is done. But if you're going to be playing basketball this winter, you're going to be a wrestler, get your body ready. Start preparing in September, October. Don't show up to practice on November 1st.
Amen. I think that's great advice. Dr. Zaremski, thank you so much for your time. Really appreciate all of this. And if anybody would like to follow you, any of the stuff that you do, is there any way that people can follow you online?
Yeah, I believe I don't know if we call it Twitter handle anymore, the X handle, is that what we're calling it?
Yeah, I guess so.
Is Dr. Z Sports Doc, I think is what it is. And then I think Jason Z14 is my Instagram handle. But yeah, usually on Twitter X or X, I'm usually, when I post stuff, I do a lot of research in throwing and baseball, so a lot of sports medicine stuff. I try to stay away from all the other stuff that's out there in social media right now, all the political things. But yeah, I mean, if folks want to follow me, ask sports medicine questions, I'm usually happy to answer, as long as folks are cordial and polite and things like that. And sometimes it works really well on social media if it's done the right way.
Absolutely. And of course, all links and information can be found in the description of this episode. Dr. Zaremski, thank you so much, and wishing you the best for all the fall sports seasons.
My pleasure. Thank you so much.